Dr. Stuart Johnson, a pharmacologist at King's College London, has analysed the plant and controlled trials are now underway. Dr. Johnson, how did this little plant end up in your laboratory?
Well, towards the end of the 1970s, a number of reports appeared in the national press, really about migraine patients who were taking this plant and claiming benefit. And there were quite a large number of reports, and they were eventually brought to my notice by the migraine charities.
And you found a GP prescribing it?
Well, I did. I heard of this GP prescribing it. I spoke to him. He had about 20 patients in an open trial at that time. And also I saw 3 patients who were taking it myself. And these 3 patients were of great interest because they were those who were well known to me at the City of London Migraine Clinic as being those who didn't respond to conventional treatments. And all 3 of them claimed that they were no longer getting their migraine attacks.
Well, let's have a look at it. Now, it's a member, you say, of the chrysanthemum family.
Yes, it is. It's called Chrysanthemum parthenium, sometimes called Tennessee parthenium, but it's the same plant.
Gosh, what a long name for a little plant. And it's a perennial?
Yes, it is. It dies back in winter to about this level. The leaves are always present. A very severe frost can kill it, but usually it survives the winter in this country.
Now, it's the leaves that do the trick. It isn't the flowers, which we saw earlier.
Well, some patients take the flowers, the leaves and the stems, but most patients, about 90% of patients, take only the leaves.
Let's have a look at the dose, though. I mean, the leaf on this plant is much bigger than the leaf on this plant. So, I mean, how much do you take?
Yes, well, plants differ in age, of course. This is a much older plant than this one. And this particular leaf is what I'd term a small leaf, and about 3 to 5 of those are taken a day.
Every day?
Yes, every day. And sometimes for considerable periods of time. I know of many patients who've taken this for more than 5 years, every day of their lives.
Now, the very name feverfew suggests that someone somewhere, when they gave it a name, knew that it had some medicinal property.
Yes, the origin of the name feverfew is probably because it was used to allay fevers and inflammatory disorders. Although others say that it was probably from the name, its other name, featherfoil, because as you see, they're rather feathery leaves.
Yes, indeed.
And that may be the reason it got its name.
What was the very first reference to it?
I'm not sure what the first reference to it was, but it's certainly mentioned in all the herbals. Not for migraine, I might add. Its use seemed to come much later.
Now,
migraine.
arthritis, not just migraine, arthritis has been
yes,
used for it.
I mean, in the herbals, it was used for arthritic disorders, certainly, and swollen joints.
And childbirth?
Yes, it was used as an abortifacient. It was also used to expel the placenta, the afterbirth.
You gave out questionnaires to people who'd taken this, for more than a month?
Yes, most of them, by the way, had taken it for many years. In fact, I've got 290 replies now to the questionnaires, and the average consumption time was just over 2.5 years.
You wanted to find out if it worked. Did it?
Well, of course, that's hard to say from such an open study, but if you bear in mind that most of these patients had taken other treatments before and hadn't gained benefit, then some 70% of them claimed that this plant either reduced the frequency or severity of their migraine attacks.
That's an incredibly high proportion, 70%.
Well, it is. It certainly surprised me
yeah.
when this came up on the computer printout.
Now, you've analysed the plant. Now, what did you find which would lend itself to getting rid of a migraine headache?
Well, there were a number of compounds which we think might have biological activity which is consistent with an anti-migraine effect.
What about side effects?
There are side effects.
Good ones?
As you saw in the film, very few drugs and certainly no herbs, I would suspect, are free of side effects.
There are good effects from this, aren't there?
Well, there are, but first of all, if I mention the side effects, the commonest side effect is a sore mouth, soreness in the mouth, often with mouth ulceration. And that occurs in about 10 to 12% of individuals and can be troublesome in about 6%.
And indigestion's a problem too, isn't it?
Indigestion as well, yes, in about 4% it's troublesome. Sometimes the abdominal pain's been noted.
But the good effects are that people sleep better?
Yes, they tend to be feel more relaxed. They often describe a sense of well-being which is new to them. And those who've had arthritis as well certainly claim relief from arthritic symptoms.
Now, Kitty Campion mentioned in the film that plants can have bad effects, that
Yes.
you could overdose yourself. Could you on this?
Well, I don't know. I'm not sure. I suppose one could if one ate enough of it. The people I've studied have taken this in fairly modest dosage. Although I have come across individuals who've taken very large quantities and not been ill as a result of it.
You say there's nothing magic in the word natural, don't you?
Well, yes, that's my own view, yes. I think that very many natural things, as was pointed out in the film, can have rather nasty effects. I mean, you know, there are very many dangerous plants and herbs. If we start with digitalis, the foxglove, which is useful in modest dosage, a slight increase in that dosage will result in toxic or harmful effects.
You've applied for a patent to produce a synthetic version of this.
Well, some of the chemicals within it, yes, which we've identified.
So it's quite a lot
not to produce them, but to cover those. We've applied for a patent to cover those compounds.
Isn't there a danger, though, that you may be interfering with the very balance of that plant if you just draw the substances out and produce it synthetically, so that may have, in its turn, side effects?
Well, this is something which is often said, but there's very little evidence for any plant that is the case, actually.
Somebody quoted an example of a plant called ephedra, where it cured
Yes.
asthma, and when produced synthetically, it led to high blood pressure.
Well, yes, but of course it's only fair to point out that ephedrine is still used in the treatment of asthma, and that's a substance which comes from that plant, and very effective it is too. It depends how you take it.
I guess doctors should be taking more notice of what people have been doing for years. Dr. Stuart
Yes.
Johnson, thank you very much indeed.